Uh, Good evening, everyone. So today we are going to see about the evolving role of oncology clinical pharmacist in modern cancer therapy. The Our Dr. Kalyan, who has been graduated from Aditya College of Pharmacy, who is working as clinical pharmacist in Basavathrakam Indo-American Hospital. He is having a keen knowledge in oncology. He is going to present the session. So get him over. So you can continue.
Yeah, thank you for the introduction, Ajit. Hi, guys. Today I'm going to explain about the deep down evolving roles of an clinical pharmacist in cancer therapy. So, yeah, wait a minute, let me. Yeah, coming to the objectives here, at the end of this presentation, we should be able to appreciate the breadth of the responsibilities handled by the oncology clinical pharmacist, and we can understand how our impact is specialized domains such as pediatrics, bone marrow transplantation, and in adult care wards. And according to that, along with that, visualizes a typical working day that reflects the complexity of our provision. And also, we will see here how the role of prescription audits and pharmacovigilance is ensuring safe practices. And along with that, we will also discuss here about the real world cases that demonstrate measurable improvements in a patient care. Coming to the introduction, cancer therapy has rapidly evolved with chemotherapies, target therapy, immunotherapy, and cellular therapies now shaping the treatment landscapes. These therapies are very powerful, but they are also complex and prone to high risk errors. This is where clinical pharmacists step in and we bridge the between cutting edges, science, and the patient safety, ensuring the therapies are not only evidence based but also practical, accessible, and personalized for each patient. Yeah, oncological clinical pharmacist is nothing but a medication expert who goes far beyond dispensing, who assess pharmacology, pharmacokinetics, and pharmacogenomics and patient specific parameters to ensure safe and effective cancer treatments. Importantly, we serve a medication guidance within the multidisciplinary teams, which will collaborate with the oncologists, nurses, dietitians, and psychologists to maximize outcome and minimize harm. Yes, challenges. Coming to our challenges are multidimensional. Here, at the patient level, and also we will involve in the patient counselings, and we will go deep down researches and finalizing the protocols regarding the treatments and patient medications. Yeah. Here, at the patient level, we will go differences in age, comorbidities, socioeconomic status, and adherence influences the outcomes. All these disease levels, the sheer diversity of cancer, rapid resistance mechanism, and molecular complexity demand constant and adaptation. At the treatment level, we face polypharmacy, high toxicity, regimen complexity, and many of these regimens impact long-term quality of life as such as they do individual survival. Actually, sorry. Yeah. Next here, yeah, coming to our role. Here we will involve in yeah. This slide is very comfortable to say. Yeah. Our core responsibilities are summarized as like this. First thing, personalized medication. Here we will tailor the drug regimens to individual patient profiles, including their comorbidities and pharmacogenomics factors. And therapy optimization, here ensuring accurate dosing, schedule, and compatibility with supportive care. And adherence enhancement, following up with patients, addressing toxicity, and simplifying regimens where possible. And coming to the patient safety, proactively preventing both short-term and long-term toxicity. And we will also involve in the few pain and palliative care wards. Here, we will managing the pain side effects and long-term complications to balance cure with the quality of life. So, and also I'm going to explain how the clinical pharmacists are involved in BMTs and pediatric units in oncological units. Yes. In BMT, uh, on BMT and also pediatric oncology, the role of clinical pharmacists become very more specialized. Here we provide patient-centric care and ensuring fragile patient receives the safest therapies, and we manage the supportive care and toxicities, which are critical and immunocompromised populations. And here we also do the chemo reconstitutions along with the protocol which are scheduled to the patient to minimize the errors. And we will also contribute to modern roles in precision oncology and immunotherapy uh, according to the protocol development. Yes, even same we will follow in the pediatrics, but we will take a bit more care in pediatrics for the children who are underdiagnosed with the ALL, AML, and Ewing sarcoma cases, which are I am daily seeing these cases. So we need to take very specialized care to the kids, because even any small error which was caused by any of the multidisciplinary team, it may show the lot of effect in patient's journey in the chemotherapy or in the maintenance phases also. Yes, here I'm simply discuss. I want to simply discuss about my day in my daily life. So whenever I went to the hospital, before the consultant arrives to the rounds, I will do some pre-rounds which I'll go and directly involve with the um junior resident doctors, or myself. I will go and meet the patients there along with the patient attenders. I will talk either they are taking the proper medications or they are missing any medications regarding the patient's conditions. Like someday patient may experience nausea or feeling, because of that reason patient may skip the medication in the daily dosages. So here we need to note this, because few like antifungals or any medications they need to take daily. So meanwhile, because of these situations they may avoid that, it will uh, affect the patients negatively. So here we need to report that to the consultant before whenever we are doing the rounds. And also here in our daily rounds we will uh, we are having a very um, good multidisciplinary team here. In this team, we are involved along with the consultants here. The clinical pharmacists, psychologists, and dietitians, and many residents will also involved in this. So before, whenever the consultant came, when we are going to meet the patient, before the rounds, we will discuss each and every case, elaborate every medications. We will discuss daily what are the complications they are getting. We need to do any modifications in the doses, or what are the treatment regimens, is there any changes, we will do it. And after that rounds, is there any chemotherapy medications, I'll going to reconstitute those medications. And I will check every half an hour while the medication is on fly, and I need to be reported areas if any reported. And also after the post rounds, I will some of the patients might be get discharged. I will also involved in those discharging process. I need to explain the discharge summary clearly to the patient and their attenders, how to take the medications. And I will do the patient counseling here, which is I will say about the medications, how to take, what medications should be stopped if any area, any complications are there at their home premises, when they need to come back to the hospital immediately. Yes, and yeah, for every clinical pharmacist, these are the main skills should have to be there. Yeah, these are very mandatory skills that always the clinical pharmacist to be updated in the stream, which is always should be updated in the pharmacology, pharmacotherapeutics, and also the pharmacokinetics. And also we need to review the every research article at every time. We need to be all updated, and we also need to be uh, more improved communication with the patients, because some might be clearly not explained regarding their socioeconomic problems, or they need to be uh, regarding the treatment also they are having many doubts. So while we are communicating with the patients, they will let us know to how to do it. Yeah, coming to the prescription audit, this is a very important uh, thing where the clinical pharmacists are going to do. This is a sample case where I did reported the ADR in my hospital. Here, the prescription audits are very rational prescribing, reduces the polypharmacy and identify the inappropriate, and also ADR reporting, on the other hand, build evidence on real world toxicity patterns. Together, these activities protect patients, guide poly changes, and improve the hospital wide treatment standards. In oncology, very toxicity is often the price of cure. These function becomes absolutely indispensable. Yeah. Coming to this reporting form, here we need to mention the date where on which day we just find that ADR. So here the patient name is Nakshatra, where she's took that the drug apical aspergillus on that day. So after immediate going of just around 3 cc of diluted solution, after the testing dose, she immediately got severe chest pain and a cough. So as per the physician advice, we administered 0.5 cc of Evil mixed with the 50 ml of normal serum over a period of 30 minutes. After completion of this infusion, we monitored the patient for an hour before restarting the medication. After whenever she settled within the hour, after that, we just restarted the other medication. Coming to the prescription audit, here we need to mention the patient sample size, how many patients we are going to be do the prescription audit on that day. And we can see here the first column, has this patient complete ID has been written clearly correctly in the medication chart or not. So we need to check the patient prescription and the drug orders daily, either everything has been written clearly or not. And also we need to mark here if the patient is having any allergies, and also we need to write the medication orders are written in capital letters or not. And also if there any uh, error prone abbreviations which are not ununderstandable to the other doctors, or also we need to be mark it as if any mistakes are there in that. And also here we need to check very thing seriously, which is are the medication orders are clearly with the correct name of medicine, route, frequency, time of order is either going or not. We need to be checked and we need to tick here. And along with that, we need also check that is there any transcribing or prescribing error which are done in either in the wrong drug, wrong strength, or wrong dose to the wrong patient. And and also we need to mention that is there any drug interactions, or is there any possibility of drug interactions. And we need to tick here, and we need to we can see here there is a second page which is medication errors right in here. So whatever the reason is there, we need to write in this clearly, to either is there any transcribing errors, we need to be write there clearly. And is there any mistakes were done in the reconstitution of drug or labeling the product or administration of the patient. So we need to be monitor it very carefully, and we need to be mentioned here. So here, yeah, coming to the real world impact, here there is a case study where the patient is having grade 3 of oral mucositis, has been advised the lignocaine. The patient who are taking the more amount of methotrexate drugs may can experience these type of oral mucositis. So here we will advise some mouthwashes to the patients to be take oral hygiene care around to maximum amount of oral mucositis may uh, get some what do we say uh, uh, yeah after 1 week symptoms has been reduced. So here what's the mistake has been done is the doctor was written chlorhexidine mouthwash and the patient was took lignocaine. So here there is an error which was reported by a clinical pharmacist. And coming to the case two, the patient is prescribed a capsule apretent 125 mg day 1 and 80 mg day 2 and 80 mg day 3 for prophylaxis of CINV patient. And the patient came back to the hospital after a 1 week of chemotherapy, which complains of multiple episodes of vomiting, electrolyte and depletion, and weakness. Here, what it revealed was the patient has takes 125 mg tablet, which was scheduled on the 1 hour before the chemotherapy, and the other two tablets for subsequent cycles was she didn't used it. So so because of that, some of the patients may take anthracyclines, which is like doxorubicin or daunorubicin. Those are highly emetic. So we will doctor will advise these types of apretant drugs, which is which can control the vomiting and nausea sensations. Here, what the patient mistake was, 1 hour before when we are the administering the daunorubicin drug, the patient took it only 125 mg. The rest of the day 2 and the day 3 80 mg doses were not taken. So the clinical pharmacist was correct these type of errors in they will report to the consultant. So these type of things will be managed by the clinical pharmacist, and we can also manage many errors which are not going to be serious and threaten to the patient. So coming to the career opportunities for oncological clinical pharmacist, here there is a residency programs in many of like Tata group of hospitals, and also there is a residency of oncology, and also there is a good scope in pharmacogenomics and clinical research. uh, yeah, in oncotherapeutics there is a Tata Memorial Hospital where you can get a high cases. There you can learn a lot, and also they will provide some stipends to the clinical pharmacists also. Yeah, thank you. If you have any questions or any thing, you guys can reach in our social platforms where we can available in LinkedIn, Instagram, and YouTube, and official pages of where we will available in social network. And thank you so much for FCPA organization to give me this wonderful opportunity. Yeah, thank you.
Uh, Thank you, Kalyan, for your wonderful presentation. It's been good to hear your experiences of oncological clinical forms and know from your examples what are all the clinical forms is doing, what are the opportunities are there and available for at the platform out there for the form refreshers. Thank you once again, Dr. Kalyan.
Yeah, thank you.
Okay.